Good morning, everybody. Welcome to this is June, to the June Disabilities and Conditions of Aging Network meeting. If you're new to this is really intended to be a monthly virtual table where anybody who is working within the disability community, who is themselves a member of the disability community, can simply come together and talk about what's going on in our particular niches of that community. I'm Jeremy Warner. My organization is Walking Spirit. It is my own for-profit company that is specifically about advising really originally the hospitality industry, but really anything in the private or public sector about not just ADA training, but going beyond the ADA to ensure that we are creating as much of that we're including as much of our population as possible. And people with disabilities are the only culture that I'm aware of that crosses every other demographic and that anybody can become a member of at any moment.
Mhm.
And so, with that in mind, I am going to pretty much turn it over and pass it around to folks. However, I am putting in the chat, my contact information so that everybody can have it. Please put yours in as well. Any links that may come up as you talk, or anything that you want to get in there to share from an information standpoint, I will send that out to folks afterwards. Although I may be a month behind. Things have been really crazy, and I am going to put in the chat today because I think it is vitally important that not only we do it as individuals, but that we tell other individuals we know to do it, to the information to contact Senators Young and Banks, as well as Governor Braun's office and FSA Secretary Mitch Rube's office, to contact them and let them know that our senators have to vote no on the One Big Beautiful Bill Act, because that is going to cut Medicaid. There is an article in the Star. Both Mitch Rube and the governor have stated that at the cap that the bill came out of the Senate committee with on the Medicaid provider tax at 3.5%, that will not provide the funding that Indiana's been using a 6% tax to be able to provide the funding for Medicaid. And that's going to cause us to drop to a point where they can't fit it in the budget, where they can't fit HIP in the budget. So they're not arguing or asking them to restore that to the 6%. They're asking, I believe, if I'm don't quote me on this, read the article, but they're asking for more flexibility to decide who is eligible so that they don't have to have as many people eligible. Um, and that's me saying that as an individual. But so I'm going to post that information. Um, I'm asking everybody over Facebook and everybody I know, regardless of when I come across them, to make those calls or send those emails over their websites, or in the case of Mitch Rube's office, sending them an email because their phone number is not published anywhere, to let them know that he needs to be asking our senators to vote no until that's restored to allow HIP to be funded in the budget. And same thing with our governor. So I know some of you are maybe in a position where you can't do that. I ask that as individuals, you try to if you can, and you know what your risk is. And I feel ridiculous saying that we live in a world where there is risk of us as individuals speaking up. Um, but I I hear that and feel that from everybody that I talk to. So I ask that you consider what you can do and speak up. So that in mind, I'll post that information in the chat. And I want to make certain that some folks who sometimes have to leave early get to go first. Please do put something in the chat if you have to leave early. But I'm going to call on Heather Wildrick Holman to go first.
Thank you. Good morning, everyone. Heather Wildrick-Coleman here with Firefly Children and Family Alliance. A couple updates from us is that we were excited to get the some of the I'm going to misspeak the Indiana Health Health First Indiana funding. It's been interesting. We were supposed to get that award early this year. Then they backed it up to, I believe, May. Then we were backed up another month. So we're still like, it's still coming, but we're not sure when, all the T's will be crossed, the I's will be dotted, all of that. But with that, we're expanding our safe sleep services, really just trying to reach more diverse populations and reach maybe potentially any corners of Marion County where maybe we have not yet reached yet with our safe sleep initiatives. With that as well, I am looking for an part-time outreach coordinator to kind of help us. It would be a lot of nights and weekends, but if anyone knows of anyone who could potentially commute to the Marion County area, lives in the Marion County area, we would love someone who's bilingual. I'll put this information in the chat as well, but that'll be kind of part of our grant as well. I am not part of the CCDF program, but I feel it's worth noting in various spaces that if you know of anyone who receives CCDF funding, which is the Child Care Voucher Program, um, Firefly operates a great majority of those programs throughout the state. Just really encourage folks to continually stay in contact with the CCDF office, with the child care providers if they're receiving, because we're back to a tremendous wait list. We're hearing that July 1 they're going to open up some spots, but because the wait list is so huge, those will quickly be gobbled up. But one of the ways, because there was the shortfall, there was overspending in that program, not by Firefly, but by the government. We've just had a lot of sadly disgruntled folks losing that. But that is one of the ways I think they're trying to quote unquote trim the, you know, whatever you want to call it. They're just looking for people to mess up and then lose it. And then you're back, number 1,000 whatever in the line to try to get those services going again. So I may not be articulating that as eloquently as someone from our CCDF office, but I thought it was worth noting in this space. If you know of anyone receiving that service, just encourage them, empower them to really stay on top of it. But I think those are my main updates today. Thank you.
Okay. Thank you. Anybody have any questions, comments? Okay. Then I will go ahead and call on Allison Weimer.
Hi, everyone. I'm sure, you, I've been here. I don't know if there's anybody new. I think everybody knows me by now. The systems change manager at the Governor's Council for People with Disabilities. So the council, the last time I think we met, I was talking about council and community. We are still doing that. It's been really successful. We're going to be wrapping that up at the end of July. If anybody out there would want to host us for council and community, we're particularly really interested in going kind of outside of the Indianapolis area, but even in Indianapolis, I mean, like we want to get, we want to get not only input from the developmental disabilities community, but also to educate people on what the council does, on what the DD Act is, on what what we do, and what our mission and vision is basically, and then just get input from people on what makes a good life for people with developmental disabilities in Indiana. So if you're interested, please contact me. I'll put my contact information in the chat. But it's been really successful, and we've gotten a lot of really great feedback. So that's basically what we've been up to, or at least on my side of things. We've also been doing our working on our family coalition. And I know Beth's here. She's our chair. So if she wants to speak more on that, she can also, if Beth, if you wanted to talk, or Ryan, he's one of our council members. If you guys wanted to speak more on the Medicaid side,
I
that's
plan to.
okay. So I will let you take the lead on that, but that is also something that's been a focus for us. So yeah, so that's basically what we've been up to. And if you have any questions, please, go ahead and contact me. But we're just plugging along. So
I love that, Allison. You mentioned wanting to share more about what the Governor's Council does to support the community. And if ever you, Beth, or whoever would like to have a conversation, we'd be happy to do an article in Uniquely You and highlight the Governor's Council. So just reach out and let me know when we can do that for you.
oh yeah, I will. I'll talk to Kate, my executive director, and get her in contact with you.
Perfect.
So
Sounds
that we
great.
can have a conversation. That'd be
Love
great.
it.
Thank you.
Absolutely.
Awesome. Thank you.
That is exactly why, like, the idea of having everybody come to the table. And I am guilty of the fact that Jamie has made the same offer, and I consistently allow other things to get in the way of me focusing on walking spirit and doing the things that I need to do to do that. So thank you for the reminder.
That's okay. No worries, Jeremy. We're here when you're ready, and we
Uh,
can help in any way to make it easier for you. So just let
I
us know.
just keep pushing every now and then. That's, yeah, it will work one day. So anybody have any other questions or comments for Allison? All right, then Jamie, I'm going to ask you to talk about Uniquely You for a minute.
Yeah, I can go real quick. I just seen that Richard put in the chat if he can go, so I'm happy to let him go before me.
Did I, sorry, what did I, sorry, did I miss something in the chat? Yeah, absolutely. Rick, I didn't know that you were here.
Sorry, I do have to get going pretty
Yeah.
quickly, but I do want to share with you that the ADA Steering Committee did have a meeting yesterday with Todd Rokita's office. Corey Voigt spoke about the Texas lawsuit and reaffirmed what we've been saying, that their primary issue was with the definition of gender dysphoria being included in the definition of someone with a disability. They were unaware of all the ramifications of, as I said, throwing the baby out with the bathwater, and the issues of the rule, the final rule, and the process that it's gone through to under 504 to become adopted to be more consistent with the ADA, and the fact that it's been a number of years since that rule had been updated. It also included, medical equipment in hospitals and doctors' offices and things like that. There are a load of things that he was, it seems like, was not aware of what this Texas lawsuit was alleging or was potentially causing problems for. So Marcy Hinsman from Great Lakes and I, and some other folks on the in the meeting, were able to, I think, very clearly and eloquently speak to that point. And at this point, he said he was going to be talking with Todd specifically. He reaffirmed that Todd's support for the disability community was significant by the fact that he has a son with a disability and his other, involvement with HAVA and things like that. So, bottom lining it, the Attorney General's office is very aware now of what this lawsuit could potentially do in terms of the constitutionality of 504. And it sounds like he's actually taking it to the Attorney General and having him become a little more aware of what this thing is doing. So good progress that way. I was really glad to be able to meet with him and have conversation. He did offer us the ability to talk with him specifically and directly Um, so if you've got something you want me to share with the Attorney General's office related to this or anything related to disability, then let us know. We will certainly do our best to make sure that we get that done.
Rick, is your contact info in the chat? And do you want to put,
My contact info,
yeah.
I don't know, but I certainly can. I have no problems, and unless I keep getting more calls asking me to sell my property, um, I will continue to put my cell phone out there. You've got it, certainly, Jeremy. Feel free to share.
Okay. Um, and in terms of if people want to contact you about that, do you want that to go through your what email address do you want that to?
Use Rick.
Okay. So yeah, I'll get that in there.
And
Um,
also,
so
the
we
have you talked about the MAC, the board or the transportation Indigo's increase? Have you talked about that yet?
I have not. I did go last night
Good.
and I it was heartbreaking to listen to somebody cry about feeling as if people with disabilities are being attacked from every direction and that our ability to move around the city is now being attacked. That's the way they felt. And my understanding from what I heard, and I didn't necessarily understand all of it, but is that for um, because I don't necessarily utilize Indigo myself, but for paratransit services, the price increase is $2 per trip. For fixed route, it's $7 per trip, but there is a cap, and this is the part that I didn't fully catch, but there is a cap in regards to that for people who use the virtual or digital MyKey thing to pay for their rides and only on the fixed route, not on the paratransit. And the percentage increase because Indigo, this is all because Indigo hasn't increased their rates for apparently 16 years. Um, and it's a shame Kendall's not here because he certainly understands it
I
better.
am here.
Oh, you are here. Great.
Yep.
Kendall, I'm going to ask both Beth and Kendall to correct anything that I say that's wrong about anything, because it is highly possible that I'll get some of this wrong.
Sure.
But
I appreciate it. Let me, if I can, butt in and say I need to get gone.
okay.
But if you have any questions on anything that I spoke about, then obviously please let me know. I appreciate your time, your willingness to let me bump things up a little bit, but you know how it goes.
Yeah, absolutely. Thank you very much.
All right. Thank you guys. Good to hear you. Good to see you.
Yep,
Get back with me, Jeremy, on my email if you wouldn't mind.
I will.
Thank you.
Absolutely.
All
Thank.
right. Fantastic. Talk to you guys later.
All right. Bye. Um, so yeah, I was saying basically the thing that really stood out to me is that for people who utilize paratransit services, it is a 57% increase.
So
All Kendall, you
it's
want to jump in?
57% across the board.
Oh, I thought it was 50%, 7% specifically for the paratransit.
Now the way they, yeah, it is, but it's all it's 57% for across the board, except fixed route users have the ability, if they are 5 day a week users, to have a cap on the amount they spend per week using the MyKey card.
Right.
So and one of the things that I was advocating for is for people that are using paratransit, it's there is no such cap, and so theirs is going from 350 to 550 per trip. So we're talking about $11 a trip for people going back and forth to work, um, but there's no cap on that. There's no out of pocket. There's no wait. So unfortunately, it's so far has not been considered.
Right. Um, Yeah. So, Kendall, do you want to continue on and cover that and Noble, and then we will go back to Jamie, and then probably to Beth. So,
Oh, sure. So it has not though. So the fare increase has not gone before the board yet. So that's our target audience right now. Is hopefully the board makes some alterations to the fare increase. Um, they need the money, so I think they're going to get it one way or the other. One of the things we know is that for paratransit, the daily riders is a very small number of of the total ridership. Like the vast majority, like 70% of rides are less than once a week. So from an income standpoint, I think getting that cap may be doable because it won't hurt them much as far as the income of this. So I'm hoping that is something we could do. The thing we haven't talked about is the beyond ADA. So for people that are not within a half mile of a bus route. So the ADA mandates that um, service be provided. It does not mandate it beyond a half mile of the bus route. Those people will be paying $11 per ride. Uh, so $22 a day to ride that paratransit service. So that's the group that really gets hit. So it's anybody beyond a half mile of the bus route. So anything else that you want to know about the meeting last night? Any other questions? All right, so I put in the thing we are having a virtual parent cafe. We've hosted parent cafes and we got feedback that it was difficult for people to make it out during a weeknight. So we're trying a virtual parent cafe, and that flyer's in the thing. For those of you that haven't been familiar with them, parent cafe is a chance for parents to come together in sort of a structured way, and discuss parenting. We are targeting parents of uh, children, and it's not necessarily children. Some of our
yeah.
parents are also adults, have have their children who are adults, um, but have disabilities. It's a more unique community. So if you have anybody that wants that, it's a really nice support group. Um, it's a structured environment where they get a chance to learn from other parents, and it's powerful and super informative because you're not getting somebody that doesn't know what they're talking about. So that's coming up. It's our first one, and that is July 23rd, 5:30 to 7:30, and the flyers in there, and check in by Zoom. Those are my updates.
Okay. Very good. Thank you. Um, and I will try to be better about getting the flyer and everything out after this meeting today. Jamie, do you want to jump in?
Yeah, a real quick, Kendall, I was going to mention I went ahead and downloaded it, emailed it to myself, and we'll add it to our July email that we send out here on July 1st. So we'll definitely spread the word for you guys and get it on social media. I did put a couple fun things in the chat if you guys hadn't had a chance to take a peek at it. We already have our ice cream social in the park at Independence Park down in Greenwood happening on July 19th. So if you would like to attend or share that to other people that would see value in that, we have Howdy Ice Cream. They employ adults with disabilities, and they'll be serving ice cream to all those in attendance that day. So that'll be a fun event. We also have our upcoming event we're doing at the Busy Bee Play Cafe. That'll be on August 15th from 4:30 to 6:30. We have our community happenings. So if you guys are ever out doing something or with your community or want to take a picture, upload it, you can post it. The link to do that is in there. We are going to kind of have a fun community happening section where people contribute things they do in the community. We also have a way that if you guys can automatically share your events and upload flyers monthly with all the deadline dates and things there. So if you have events that you want us to share in Uniquely You at no cost, you can upload that directly to that link and we'll get that shared for you. And then the last thing we just incorporated was a new professional expert spotlight. So if there are experts you know that really work well and know a specific thing they do that supports the community, we can highlight their mission and vision and share more of their expertise to bring more education to support more people in the community. So those are some new sections. I did want to let you guys know that I'm in communication with Cocktails and Caregivers, a really cool nonprofit based here in Indy. And we're going to be doing quarterly caregiver connection days for caregivers in the community to come out and connect and build relationships. So our next event for that will be coming up in September, and I'll be sharing more details as we get closer to time. So that's really the updates that I have here for Uniquely You. We actually, one more hot news, Lisa Jagan, dear friend of mine for a decade, she also has a special needs child and she lives up near South Bend in Goshen. And she is bringing a Uniquely You to Northwest Indiana, specifically for the Porter, Goshen, and Elkhart, and I believe one more county up there in the Northwest Indiana, kind of the rural county area. So we're excited to have another presence up in the Northwest part of Indy to support the rural county. So that's my updates. Thanks, guys.
That's very cool. Congratulations on that. Um, thank you so much. And Jamie is a tremendous supporter. So all of you, please connect with her, and if you have not already. So Beth, please correct everything I got wrong at the beginning about Medicaid.
you you weren't you weren't wrong, but I can give you some details. I was on a Medicaid advocacy call yesterday with the National Association for Councils on for People with Disabilities, and I also track it for my vulnerable babies in the NICU, so I keep pretty up to date. Um, so we are dealing with some impacts on Medicaid on both the state and federal level, and you talked some about the state level, Jeremy. Um, Basically, Senate Bill 2, which was what was going to provide Medicaid limiting actions at the state level, has passed and is now Senate Enrolled Act number 2. So it's here. And the things that are impactful from a state perspective is that there will be work requirements, and you're going to have to show that you're disabled. You're going to have to prove you can't work if you're not working as an adult. There are also quarterly eligibility reviews. And if anybody looks like they might be ineligible or their address is not working or whatever, then that will trigger a eligibility review mail. And if people don't respond to their mail, then it will trigger a Medicaid denial. So although they can say they're not cutting Medicaid, these requirements will have that effect. There's also strict rules around presumptive eligibility that like hospitals and different healthcare providers will qualify someone for Medicaid presumptively because they should be eligible. There's strict rules around that now and consequences for losing that ability if you don't do it the way they want you to. And so these are just some of the things that they are saying prevents fraud and abuse, but it effectively just removes more people from Medicaid. I anecdotally am seeing a lot more denials, like timely denials of Medicaid, not necessarily inappropriate ones, but like kids who had newborn coverage getting letters of denial right at their first birthday, which that has a different eligibility. So it's very, very probable that they aren't eligible anymore. And that's not an in error decision, but the promptness with which they're denying is notable. More important right now is what's going on at the federal level, because there is still some ability to have input into that. The in the federal reconciliation bill, which has been named the big beautiful bill, ironically, cuts $800 billion from the federal Medicaid budget. That's most of the budget. In that bill, there's lots of words. And what's most impactful for people with disabilities is that it doesn't exempt from these cuts home and community-based waivers or long-term supports and services. What it does exempt from these cuts are nursing homes and institutions for mental and behavioral issues. So our concern is that when these cuts come across at the state level, there are only two optional Medicaid services that they can play with. One is HIP, which is our Medicaid expansion program, and the other is home and community-based waivers. Both of these have significant impacts on our people with disabilities. Obviously, the waivers do, but there's a lot of working people with disabilities who are on HIP. We were told at this meeting that we've spent a lot of time arguing for Medicaid for all the people who can be hurt by these cuts. And it's not just people with disabilities.
Right.
But now is the time to focus on what hurts people with disabilities. There is no question in anybody's mind that this bill is going to get approved. It's going to pass. But it's still in conference committee. So House has a version, Senate has a version, and now they have to see if they can agree. So unless the House says, yes, we will take the Senate version as is, and then there's nothing we can do about that. But we don't think that's going to happen because there's a lot of House people that don't like the Senate version. And so we think it's going to go into a conference committee, and that makes it changeable still if it does that. And we will have both Senate and House people working on that. So it's contacting your Indiana representative as well as your Indiana senators. And the message for people with disabilities is right now is you have provided exceptions to cuts for nursing homes and institutions. Please put in home and community-based waivers, which are long-term supports and services. By doing that, you will not only protect people with disabilities from losing these important services, but you will prevent a lot of people with disabilities from entering into institutions, which are, one, not sufficient to handle all these people, and two, are way more expensive than home and community-based services. If you exempt from cuts home and community-based services, that will allow people with disabilities to remain in their homes and communities, and that is far less expensive than institutional care. So it's both you need to protect people with disabilities message, and don't be a fiscal idiot. This is, I mean, don't say it that way, but this makes no sense fiscally. And so it's a powerful argument because it's not just about doing the right thing for people. It's about doing the right thing for society, and keeping the people with disabilities in their homes and communities is best for all concerned. So that's really our ask. The other, something we probably can't focus on right now, but there are people really focusing on this. There is a provision in here that if states provide emergency Medicaid to undocumented immigrants, which Indiana does, we provide emergency Medicaid. It sucks. It's just for emergencies, but it's better than nothing. States who provide that will lose all of their federal Medicaid funding. So that effectively is going to remove any option for Medicaid for our people who are not citizens, which is a lot of our neighbors. Is just part of the vilification of those folks. So I don't think our advocacy as a disability community is about that. But if you're concerned about immigrants and want to make a separate call about immigrants, that's part of that bill. Questions?
I'm going to email you, Beth, and connect you to Lynn Jones, one of our writers. I feel like that could be an incredible topic that could really help educate people all throughout the state of Indiana and just really share the importance of what you said of contacting your local and state representatives and
Sure.
advocating for the
Yeah.
needs that we have to have in
Thank
these
you.
bills. So I'll
Lynn
connect you
is
guys together and then let me know how
a
I can
friend of
help.
mine.
Oh, how cool.
Yeah, so
Yay.
I already know that and
Yep.
know Lynn and can reach
Yay.
her. So I'm happy to reach out as well.
Okay, perfect. Sounds great.
Okay. I wrote about this today on social media too, so I'm happy to help write something about it if you need.
Very cool. Beth, when I am done with the transcript and all this from the captioning, um, can I take that section of what you just talked about and put it into the email form to go out to everybody?
Sure.
Okay. Do I have your permission to go through and like if there's something that I think you wouldn't necessarily want in there to
Yes.
write that
Please
out?
do, because
Okay.
I actually write better than I speak. And so
You said that beautifully though, and
well, thank you.
especially the what the need is.
Mhm.
So
Yeah.
yeah. Uh,
So our speaking from the council chair perspective of the Governor's Council for People with Disabilities, we have developed an impact sheet. So the Governor's Council can't ask them specifics. Like when I asked my representatives and senators to exempt home and community-based waivers from the Medicaid cuts, I'm Beth. I am not a member of the council. I'm not an employee at Riley, even though I'm both of those things. Um, so the council, though, can do impact statements and can educate legislators about the impacts of their the legislations that they're working on. And so we have developed an impact statement with the signature of several different disability organizations and have that available for people to use as education pieces for their legislators. So if that's something anybody wants to get a hold of to use, that's probably going to be finalized. Yeah, I was just going somebody asked if I could share them. Yes, it's probably going to be finalized this week. So I'm not exactly sure what day, but it's going to be available very soon, and I'd be happy to share that. And if lots of people want to see that, I can send it to Jeremy, and you can just send it out to the email list.
I am always happy to do that.
Okay, that won't have anything about what we think they should do, but it will have information about how Medicaid affects the lives of people with disabilities. And so when you are doing your ask about please don't do this or please do this, you can do that as an individual and just share that piece as some education on the impact of Medicaid for people with disabilities to help them gain further information and education.
All right.
Okay.
Thank you. Anybody got any questions for Beth? Okay. Beth, anything else?
It's all I can think about right now.
Okay, fair enough. I do want to say some of you have been hiding behind the chat box and the caption box, and that's how I didn't know that Kendall was here or that Rick was here. So let's see. Shalicia Howard, would you like to jump in?
Sure. Good morning. Um, Actually, Beth talked about a lot of what I deal with in my daily world. So we're just trying to weather the storm and help advocate and support any way we can. We are staying true to our mission. And so I do appreciate that, and that makes me feel better because sometimes, in times like this, you'll find out the values of the organization that you're with. And I love the fact that we are definitely still mission driven and all about making sure that members get what they need, as well as non-members being aware of the resources available to them. And we are still encouraging everyone, even if they don't have CareSource, to reach out to your representatives, as well as contact and stay in touch with your health insurance company, so that you can keep up with making sure everything is up to date and making sure that everything's being mailed to you, and just staying on top of everything. Because I think, like Beth was saying, that they're expecting people to just not pay attention to the mail and to just fall off. And so we're trying to put that right in front of people's faces to say, hey, check your mail, stay on top of all of that, because the moment that you let that slip is the moment that it goes away. And then you're stuck in that long waiting period and everything all over again. And, losing access to prescriptions and things like that. So yeah, that's all I have to say is we're still out here. And if there's anything you would like us to share additionally while we're out tabling and doing all the things that we do, I'm more than happy to do that as well.
Thank you. I do want to let you all know I am aware of at least two different coalitions that are trying to come together well, two different coalitions that are forming to try to address, especially the Medicaid cuts, and one that is working with the deputy chief of staff at FSSA to communicate specifically with them, and then another that is more just a the first one's more of an advocacy group focused. The other is more just several different organizations from a grassroots standpoint that are trying to communicate about how to move forward. So if anybody wants to engage with either of those groups, let me know, and I would be happy to see if I can make that connection. I am going to call on someone who is, I believe, new to the group, Rachel McBride.
Hi, happy to be here, everyone.
Welcome.
Thank you. I actually work for the city of Indianapolis. I'm a project manager for the Office of Disability Affairs. This is my first time joining this meeting, so I appreciate the opportunity to hear all of you and to get some more resources to share with the residents of Indianapolis. Thank you, everyone, for doing this fun.
It is a pleasure to have you with us. Anybody have any questions for Rachel? Okay.
I'm sorry, Rachel, I could not hear what you said, and because I have to call in through my phone because I don't have a Zoom.gov account and it's complicated. I can't hear, and my captions aren't working on my phone today. Can you tell me I couldn't understand what you said about where you work. I'm sorry.
No worries. Is it going through right now?
Yeah.
Okay, perfect. So I work for the city of Indianapolis, and I am the project manager for the Office of Disability Affairs.
Thank you. I appreciate that.
No problem.
Thank you. And Rachel, did I introduce you appropriately, or is it Rachel Kratke McBride?
I will accept either, honestly. It's a mouthful to say all three.
Okay. And so, I mean, do you want to share anything about what's going on with the Mayor's Advisory Council on Disability right now? And I don't mean to put you on the spot. I know that
No
that's
worries.
your office.
Yeah, no worries. So I'm kind of the liaison between that council and the city. I was not able to make this month's meeting. I was out of town actually at the National ADA Symposium in Atlanta last week, so I missed their meeting. But last I heard, they are still, their main goal is trying to up their membership. So if anyone is interested in serving on that council, they are always actively seeking people. And I can provide that contact information. They also just reinstated the Access and Inclusion Awards. And there's 4 different awards that they'll be doing every year. One of them is a city service award. So it's intended to be city employee. There's an employer award for a business that really champions disability in employment. There is a community award. And I forget what the 4th one is, but the nomination process for those awards is open. And I can share the links for those as well if someone comes to mind that you'd like to nominate. And then as always, we're just kind of trying to keep our foot in the door for any and all new projects to make sure accessibility is incorporated and not just tagged on at the end, to make sure it's built into those plans.
Thank you very much. And Rachel, I know you and I need to connect more soon, so we will do something to get on the calendar for each other as well. We have 9 minutes left. I got, I believe, 3 of you that I want to get through. Sonia from Accessibility, would you like to jump in?
Hi. I'll make it quick. There's not a lot new going on with accessibility. We're just like Shalisa, we're just weathering the storm. We were under the umbrella of ACL, and they've been dismantled. So we're under a new umbrella as far as funding goes. And we haven't changed what we're doing either. Our mission is still the same. We're still DEI. We're still, helping our consumers live more independently, however that is. And we just keep showing up. So that's all I've got today.
Thank you. Matt Edwards, would you like to jump in real quick?
Absolutely. Thanks, Jeremy. I'll try to keep it quick here too. So I'm here representing the blind and visually impaired community here in Indianapolis and really all of Indiana through Bosma Enterprises. So my job is an employment specialist. So I like stuff like this, come and network, learn about all the things that everybody's doing here. So at Bosma, we main line of business is to contract with the federal government. We through the Ability One program, we provide surgical gloves to VA hospitals all across the country. So that kind of keeps us in business here. About 60% of our workforce at Bosma is made up of people who are blind or visually impaired as well, from our CEO all the way to all of our production workers. So that helps us fund all our rehabilitation programs for vision loss. So we see people at the building that I work in, all across from Indiana, who are most of them new to their vision loss. So as Jeremy alluded to earlier, we're all one day away from acquiring a disability here. So if people do experience vision loss in the middle of their life, it's not over. They come to us. We train them in many different areas, and hopefully getting them ready to enter the workforce again, which is what my job is, to help people find jobs. So, real quick, we're in the middle of our STEP program. It's a student training and employment program open to any person who's age 16 to 22, who's blind or visually impaired as well. So this is a 2-week summer work program that we're in the middle of, and we partner with different businesses across Indianapolis to provide work experience during the day. We house them at Butler University in the evenings, have all kinds of activities. Did a resume night last night. It was a lot of fun. So that's what we're in the middle of. And just a side project that I'm involved with, the Indie Disability Talent Showcase, which several of you thankfully attend. Appreciate it. So it's a once a month virtual and in-person networking for job seekers with disabilities, employers, service providers. It's just kind of an effort for all of us in the disability community, especially employment related, to kind of work together, because a win for anyone is a win for all of us in that space. So my information's way up there in the chat, but it is there. So if you'd like to connect in any way, have any questions, love to talk.
Thank you,
I'll
Nick.
second. I love being a part of the disability showcase. That was incredible. And thank you. It was neat being a part of the last call and afterward getting an email connection to somebody that's a job seeker. And then I looked at their resume and I was like, oh, she loves animals and she likes to cook. I know exactly who is looking to hire to serve in that area. So I was able to connect them with Jody with Buttermilk Biscuits, and they hire adults with disabilities and they make dog biscuits and sell them at local markets. So she is going to connect with both of them, I believe, tomorrow. So super cool, just how connections happen through having a conversation. It's amazing.
Yes, we really, really appreciate you being involved, Jamie, for sure. Thank you for that.
That is very cool. Anybody else have any questions or comments for Matt? Okay. Ryan is new to the group. I'm going to really quickly make one little last plug in regards to my work, which is related to Ryan. And several of you have been very helpful in generating applicants for the unconference, the Disability Empowerment Unconference, Nothing About Us Without Us. I put the flyer in the chat. We are still holding the application window open, simply because we want to have a group that is truly reflective of the diverse disability community throughout the state for the unconference. Ryan is one of those applicants, and happy to let you, Ryan, fill us in about you and your niche of the disability community.
I'm Ryan Steiner. I don't know. I'm not really anything. I'm just out here trying to figure out where I fit into advocacy as a disabled person. I'm getting real familiar with failure and picking myself back up and trying to figure it out. I'm on the Governor's Council for People with Disabilities, as Allison mentioned, kind of learning how to navigate asking for supports and then getting the right ones, because that's really hard. So yeah, that's just a little bit of what I'm doing.
Wonderful. Thank you very much.
Oh, and I like to talk to the police. I like to talk to the police about crisis. So that's my thing.
I was just about to say, Ryan, you sell yourself a little short there. Ryan is an amazing speaker using his lived experience to make life better for other people with disabilities. And one of the primary things he does is educate law enforcement about interactions with people with disabilities. And he's amazing at it.
So, and that is a huge, as Ryan and I talked about not long ago, that is an ongoing, consistent issue, is the police departments, wherever you are, understanding disability and being aware of that. So Ryan, you got anything else that you want to add as we close out? Anybody have any questions or comments before we wrap up for the day, for the month? Okay. Thank you all very much. This was a very important session, I believe, and I look forward to sharing the information with the rest of the network. If I just nod of heads, are you all receiving emails from me like throughout the month from time to time? Okay, because I get a lot of bounce backs, so I never necessarily know. So very glad to know that you're getting them. Thank you. All right. I appreciate you. Let me know if there's anything that you need me to share out with other folks. And I'll hopefully see you in a month. Ryan, you're going to hang on for a minute, right?
Sure am.
Excellent. All right. Let me stop the recording.